to this first open market consultation that the Procure for Health community is launching on-site treatment of hospital wastewater. I'm Carlos Larrañeta. I work for the Andalusian Public Health System, and I am the coordinator of the Procure for Health community. Before we start, let me share some housekeeping rules. This webinar will be recorded, so if you do not want to appear, please switch off your camera. The recording of the presentations will be made available on the project website after this session. The list of participants will not be disseminated. And during the presentations, please write your questions in the chat, and we will answer as many questions as possible during the session. And a Q&A document will be published afterwards. So for today's session, this is the agenda we have for today. This is my welcome, and I will introduce briefly who is Procure for Health, what are we doing, and how well have we reached to this point. After Ms. Beatriz Gomez from Corbert's Procurement Service will present or introduce the basis of an open market consultation, what are the objectives of the upcoming activities. Next, it will be Ali Faki, the leader of our sustainability working group in Procure for Health. He will present the use case that we're dealing with today, on-site treatment of hospital wastewater. After him, Karsten Lemke from Zenit will present the findings of our market analysis. Then it will be Egli Roca who will present our findings from the state-of-the-art analysis. And finally, we will have some time for discussions to solve any doubts that may arise during the session. So with no further delay, let me start. Okay, as I said, this is an activity that is launched by the Procure for Health community. So let me first tell you who is Procure for Health. Procure for Health is the European community of health and social care innovation procurers. This is how we started. We launched it with 19 procurers. As I said, procurers are health and care services providers from all over Europe, and a number of the most experienced and capacitated supporting organizations in the topic of procurement of innovation. This is how we started. Nowadays, we have over 150 members on our community. More than 70 of those are health and care services providers. So we can say that what we're presenting today is a challenge that has a relevant consensus among health and care services or systems in Europe. Okay, we're going to be talking a lot about procurement of innovation. Some of you may know already what it is. Some of you may not be so aware. As I said, we are a number of health and care services providers. We are the people that work within those services to improve our systems, our health systems. This improvement on health and care systems is a polyhedric topic. It has many phases in which it can be addressed. We are the ones that work on the addressing of this improvement by the uptake of innovative solutions that may address the challenges we face. But for us, the uptake of innovation is procurement of innovation. And procurement of innovation is the instrument. What we're saying here, or what we're doing here, is instead of going to procure a solution off the shelf that might only fit partially the needs we have, what we are saying here is telling the innovation ecosystem, if you develop a solution that solves the challenge I have, we will procure it. But we're going one step further. What we're saying is, if we like the solution you propose, we will also procure the final stages of its development. So, as I said, for that, procurement of innovation is the instrument to foster this uptake of innovation. This is the conceptualization of the procurement of innovation journey. If we take a look at it, we can say it's common sense. I mean, it is divided in phases. Phase one is for us to look internally within our organizations, to explore, assess, define, evaluate, and prioritize what are our needs of innovations, our challenges. Once we have that, we move into phase two, and it is looking outside to the innovation ecosystem and see if there is already an existing solution for that challenge we have. That's the market analysis. If not, what is the state of the art? How far are we from the possible solution? It's a state of the art analysis. And last part of this phase two, this is where we are today. It would be the consultation to the market, to the innovation ecosystem, and asking, is it feasible to find a solution? What would it take in terms of time-wise, money-wise? Once we have that, and with that information, we move into phase three, which is building tender process contracts that are reasonable and feasible. Develop the solution, and if we're successful with that, we move into phase four. That will be the deployment and the escalation and the deployment of the solution within our health systems. So what can you expect from now? With the information we receive, with the analysis of the potential solutions and what the market could offer us, we decide whether we're in the phase of pre-commercial procurement or procurement of innovative solutions. That's depend on how much development is still needed in order to reach a solution. Typically, in this tender process, we launch kind of competitions. We provide resources to all the solutions that we like. We divide it by phases, and we evaluate the progress of the development of the solutions in each phase. So this is what you can expect afterwards. And at the end, if you're successful, development the solution, you have a client. I have one final remark to make. I've been for many years working on let's say, on the side of the supply of innovative solutions. And this we're talking about, if you are able to get into one of this development process, this is not a grant, this is a contract. A contract that allows us to improve public services, and that allows the developers of the solutions to already have clients for the solutions they develop. So, I mean, I really cannot think of a better instrument to foster the uptake of innovations. And, well, that's briefly my introduction. And now I hand over the floor to Beatriz.
Thank you, Carlos. I will also share my screen with you. I hope you can see it now. I'm gonna.
Yes.
Yeah. Can you see it perfectly? Yeah.
Yeah.
Great.
It's in full screen mode. Everything okay?
Fantastic. Well, thank you, Carlos, for this fantastic introduction to the project and to the future procurement that we have in mind. So in these few slides, I would like to, first of all, give you a very brief explanation of what is pre-commercial procurement. Carlos already mentioned something about that. And also what is the open market consultation and why we are doing this activity. Okay, so what is pre-commercial procurement? So Carlos already mentioned that we are buying innovation, no? We are talking about innovation procurement. And he already explained a little bit about what is this. And pre-commercial procurement is no more than a modality to buy innovation. However, in this case, the peculiarity is that there is no solution available in the market that can tackle the needs of the public buyers. And after doing the research that usually a public buyer should do before buying a product, it realized that there is not going to be a solution soon, or not even in the midterm, because the technological maturity of the solutions that are available is very low, and therefore we still need to conduct research and development. So the key of this type of contract, as Carlos said, this is a contract. Usually in public procurement, the public buyer launches a tender and the suppliers submit their bids, their offers to this tender. But in this case, what the public buyer is buying is research and development services. So we are not buying a solution, we are buying the development of that solution, because that solution simply doesn't exist yet. So let's see that this is a way of collaboration between the public sector and the private sector in order to come up with a solution for the needs we have, which in this case is the on-site treatment of hospital wastewater. Some key aspect of pre-commercial procurement. Well, first of all, as you can see also in this image in the right side, we have competitive development in phases. So usually in a traditional procurement, there is one public buyer, one or more, and one contractor. But in this case, we have several contractors. And the reason of that is that because we are buying the development of a solution that we don't know how it's going to result. We don't know if it's going to be successful or not. We don't want to put all our eggs in one bag, and we want to have several options, not several suppliers competing at the same time in order to come up with a better solution. And as you can also see, usually we have 3 phases. The first phase focus on the solution design. The second phase focus on the development of a prototype. And the third phase usually is the let's say, original development and tested on limited volume of products or services, let's say, trying that prototype in real conditions. No? And you can also see that we start usually with a minimum of 4 suppliers, but the number of suppliers is reducing from phase to phase, based, of course, on KPIs that has been already defined on the tender documents. And these suppliers that are successful or that has successfully finalized, complete the phase 1, will be invited to submit a tender to the phase 2, and the same between the phase 2 and phase 3. Another key, let's say, characteristic of this procurement is the risk-benefit sharing between the public buyer and the suppliers. A clear example of this is, for example, the distribution of intellectual property rights. So as a general rule, of course, it depends on the case, but when we use pre-commercial procurement, we tend to leave the intellectual property rights with the providers, with the suppliers, giving the suppliers the possibility to use and commercialize this solution that they have developed during the PCP after the procurement has been finalized. Of course, also the public buyer has to have something in return, and usually is the right to use that solution free of charge. As I say, each case is different, but this is the general rule. And there is a clear separation between the procurement of research and development services, which is the object of this PCP, and the future purchase of the end product or end solutions. So once we finalize this, if we want to buy as a public buyers that solution, we need to start another procurement. Of course, to reach the pre-commercial procurement, there are a lot of work behind, because the public authority has to identify properly their needs. In this case, this has been a result of the Procure for Health project. We have been working together to identify these common needs to satisfy the challenges of the public buyers. Then, of course, we have also to analyze the market and analyze the patents and standards that are available. And in this regard, my colleagues Karsten and Egli will share with you the result of this analysis that we have performed during the project as well. And once we have these results, what we do is sharing it with the market, which is the purpose of this open market consultation, and also inform the market about what are we doing and receive as much feedback as we can. So that's why I put here a little flag. We are here to give you an idea that there has been a lot of work behind, and now we are at this step of the preparatory phase. The next step will be, in the future, if we decide to conduct this PCP, to analyze the different options in terms of cost and benefits and start with the preparation of the tender document and then launch the tender. As I was saying, why we are conducting this open market consultation and why we are today here in this event. Well, first of all, as I said, we have gathered the results of the market analysis, but of course, as it happens usual, the supply side has always more knowledge about the market than the public buyers. So they would love to validate with you if our results are accurate or if we are missing something, if in your opinion, the functionalities that we are contemplating in this challenge are accurate or no. So basically all these aspects, we would like to obtain your feedback and of course your suggestions, because if we are launching a future PCP, your suggestions are going to be essential to define the technical requirement and functionalities. Also to inform the market, not to raise awareness about the project that we have in mind. So if you are interested and you think it's something for you, you can start already working with this in mind in order to be ready when the time comes to submit a proposal to the PCP to tackle this challenge. And also, as I mentioned, collecting science. So any suggestions, any recommendations about the way we are tackling this challenge is more than welcome. In this OMC, we have a calendar with several activities. So first of all, we publish a prior information notice in the Tender Electronic Daily to inform the market about this PCP, about this open market consultation. Then we prepare and we publish an open market consultation document, which is available for you to download in the Procure for Health webpage. So in the website, you can find this document, and in this document, basically, we explain the objective of the project, the challenges that we are facing and we are trying to solve with the procurement of innovation. And also you can find information about the public buyers, the technical specifications, the use cases, and the different activities that we are conducting. The main event is today's event, the Open Market Consultation webinar in English. But we also have a request for information questionnaire, a questionnaire in new survey, in which we really encourage you to visit it and fill it in, because for us will be essential, as I mentioned, to fine-tune the future PCP. So once we have this information about the questionnaire and also the feedback, not the discussion that we can have later in this event, then we will prepare an open market consultation report that will be published in order to give account of all the activities and the result of this consultation. And as I say, we have this short questionnaire that we will really encourage you to fill in, because it will be extremely helpful. It's not very long, so it doesn't take much time for you. And for us, it's essential to conduct our work. So here I include a QR, but I will also copy the link in the chat. So if you can already access to the questionnaire. And that's all from my side. I hope I give you an idea of the type of procurement we want to conduct and why we are conducting this open market consultation. And of course, if you have any question, please post it in the chat and we will discuss it later. Thank you. And then I think I will give the floor to Ali.
Yes, good morning, everyone. I'll also share my screen. Just give me 1 second. I think my screen should be now showing in full screen mode.
Yeah, Yeah.
Yeah, okay, perfect. So thank you, everyone. Thank you, Beatrice and Carlos, and thank you, everyone, for joining this session. My name is Ali Faqih, and I work with Healthcare Without Harm Europe, and we're project partners of the Procure for Health, and we're also leading on the working group of sustainability. I will take the next 10 minutes to briefly introduce the topic on the treatment of the hospital wastewater, and why is it an important issue for us and a challenge to address. So a short context is that the hospital wastewater poses a significant environment and health risk due to the presence of hazardous substances in the healthcare wastewater. Usually conventional and traditional wastewater treatments are inadequate or ineffective in removing those pathogens or contaminants in the healthcare wastewater, which leads to the problem when the hospital discharge these considerable amounts of pathogens and hazardous substances into the environment. These end up causing problems on different levels, including the environment, for example, the effect of it on the aquatic organisms and the aquatic life, but also on the human and public life by ending up, these substances may end up in our drinking water. There's a second level also problem that this wastewater is considered to be highly hazardous or contaminant water, and it cannot be reused in any way possible. So we end up loss of water that can be reused in case if it's treated. What we have now is that due to the presence of high medicines and pharmaceuticals and pathogens and other hazardous substances in the healthcare wastewater, we have an environmental risk, but also a public risk. And what we want to see is that the wastewater treatment systems are able to treat the discharge from hospitals, tackling those substances. And this way, we would lead to more environmental adequate water discharged, but also to lower the risk of waterborne outbreaks or contamination that end up in our drinking water. To address this level, we looked at the different ways of the disposal of this or the discharge of this hospital wastewater. So either the hospital discharge directly into the environment, or the hospital can discharge its water into a municipality where it's treated and then discharged into the environment. Or we have the option where the hospital treat on site, but then discharge into the environment. And lastly, is there the treatment between both, first on site by the hospital and then by the municipality, and then discharge into the environment. What we're looking at in the use case is we're looking more into 3 and maybe 4, if later it can be moved to municipality, but we're focusing on the on-site treatment of the discharge of the hospital wastewater. So our use case is an on-site system capable of effectively removing toxic substances, infectious compounds, pharmaceutical residues, and pathogens from hospital wastewater. Now, what we expect the required functionalities is that the hospital wastewater is being channeled into one centralized treatment facility, and the wastewater goes into 2 steps. So the first step is the removing of the large solid debris and coarse materials of the wastewater, but we have very strong focus on the highly soluble reagents. For example, one of them is sodium azide, and usually these are very, very soluble in water and very unlikely to be separated in the conventional or typical wastewater treatments. The second is we wanted to work to this solution to work stably regardless of the high concentrations, and it's able to treat persistent organic pollutants, and it can meet the required wastewater discharge standards. Also, to reduce the nutrient concentrations, it should have a filter to separate the healthcare wastewater through advanced treatment technologies, but also the proper handling of sludge and that might form. It should also have odor control and the monitoring devices to monitor all the parameters or the important parameters to ensure the hospital wastewater is good. The last one before I finish my presentation is that, if possible, to use the water that has been treated through non-potable resources, for example, through irrigation or toilet flushing, so to be able to reuse this water. Thank you very much. This is for my presentation, and I leave the floor to my colleagues. Please do not forget to leave any questions in the chat. Thank you.
Thank you, Ali. So, as I remember correctly, I'm the next one. Wait a minute. I share my screen. F5. I hope you see it in full screen mode now. Yes, Carsten Lemke from Zenit here, Center for Innovation and Technology in North Rhine-Westphalia. We are one of the hubs in the Enterprise Europe network, and we are responsible for the work package 4, which is all tasks related to market analysis. So, as my colleagues just said, our colleague Ali said, he has presented the scope of the problem. We were more deep diving into the technologies for hospital wastewater treatment, also discussing the topic of centralized versus decentralized treatment, and also giving some examples for the pre-treatment in or at hospitals. And at the last point, we want to take some minutes to the potential gaps for possible R&D project. So I can skip this and you can just read it afterwards, since all of you will get the presentation, the whole presentations, and you can know the background. My colleague Carlos has presented the Procure for Health, and yeah, we conducted the market analysis since summer 2023. Different ways of researching on the web in research databases. We had numerous interviews with experts and stakeholders from industry and also from research. We visited, since it was luckily with the time schedule, my colleague Juan Carmona Schneider, who was in charge of this big task, visited the Politik Trade Fair, an international exhibition for the equipment, for technologies and services for the environment in Lyon. And we also met and participated in other events. So I would not go very deep in this topic, but the European dimension is very clear. There were regulations from the years 2000, 2006, the Water Framework Directive, Groundwater Directive, and both directives defined the rules for maintaining the quality of the EU water body. And for the treatment of hospital wastewater, both directives form the basis for the definition of purification requirements, and also the development of new technologies for the treatment of hospital wastewater. And in October 2022, the two above-mentioned directives, they were transferred to the directive amending the Water Framework Directive, the Groundwater Directive, and the Directive on Environmental Quality Standards. So this new directive covers now all relevant pollutants, and many of these substances, as Ali said, are coming from medicines and used in hospitals and under healthcare and other healthcare facilities. So many of these chemicals we just mentioned resist normal wastewater treatment. So we have to look how can we tackle these problems. So as Ali presented, we want to reduce the public health risk, and the hospital wastewater and the municipal or the domestic wastewater, there are some similarities or differences. So similar with regard to many physical chemical wastewater parameters, as you might know, but they contain increased concentrations of active pharmaceuticals, of ingredients of antibiotic resistance bacteria, etc. So those substances that enter the environment untreated, particularly via the drainage systems, pose the ecotoxicological and health risk. But remarkable is up to 90% of orally administered drugs end up in wastewater as active ingredients. So we need to tackle this. And this is also shown here in this graph on the right-hand side. So this fact offers the opportunity to eliminate the high amounts of these specific pharmaceuticals. And there is currently no single process that can be used for the comprehensive treatment of this hospital wastewater regarding the elimination of the micropollutants. And we see that there is a combination of several processes. So we have hybrid processes. They are necessary for the hospital wastewater treatment to guarantee the water and health protection. So the technologies we found on the market are quite broad, I would say, different for the treating. So coming to the key technologies we found, as you might know, are the MBRs, the membrane bioreactors. So where you have controllable porous and non-porous structures for the molecular separations. We have, as mentioned before, disinfection technologies, incineration, chemical disinfection, physical disinfection as well. And we have also processes which are catalyzed by iron oxide under microwave irradiation, so degradation reactions, as you would say. Very effective for the treating of hospital wastewaters, containing high concentrations of specific compounds. Diclofenac is one, ibuprofen is another one. If you look to further technologies, electrochemical way of treating is also a suitable way. These technologies have been developed to decrease the chemical risk in hospital wastewater, particularly if you look at the pharmaceuticals here. Alongside MBR, the activated sludge process are major effective method for hospital wastewater treatment, especially when looking back at the COVID-19 outbreak 3 or 4 years ago. So, and a process where also the right-hand picture is coming from, it's a very interesting technology, microflotation. This process utilizes fine air bubbles to separate suspended solids and oily contaminants, and it often used as pre-treatment method to remove larger solids and fat before further treatment stages are following. So, but if you look at the cost side, microflotation is cost effective, but requires a subsequent treatment stage to combat microbial contamination. So further processes we found on the market are the advanced oxidation processes, where you find the different ways of treating in the oxidation. If you look at the oxidation processes, also it's a hybrid technology which is being used with other technologies like packed activated carbon, ozonation, UV irradiation, employed also for treating hospital effluents. So these technologies are particularly effective at inactivating microorganisms. So this is also a helpful way to at least inactivate the microorganisms, such as bacteria and viruses, that they are not harmful anymore. And ozonation has the added benefit also breaking down some pharmaceuticals compounds. And main disadvantage is here the high energy consumption one needs, which has an impact on the side of the operating cost. So from the technology side, very good. From the operation cost side, not so good if you are a hospital and if you have to look at your cost side. Combination of microflotation and oxidation processes also seen on the market. These two processes are often combined in a treatment chain, also to increase the efficiency of the wastewater treatment. And microflotation unit could be placed upstream of an ozonation plant to extend the service life of the more expensive ozonation plant. So also a good and interesting combination which we found on the market. These were the technologies we found. Now looking more into detail, also from looking at solutions from technology vendors. So as I just mentioned, my colleague Juan Carmona-Schneider visited the Polytech last autumn 2023, and a reference to hospitals was only mentioned in exceptional cases during the interviews Juan conducted. So it was clearly recognizable that the hospital wastewater technologically is much closer to industrial wastewater than to the treatment of household wastewater. So, but it is difficult to find direct treatment technologies. So we would say that there is still room for innovation. So the technologies for the treatment of the industrial wastewater must be adapted and further developed for the treatment of hospital wastewater. In particular, if you look at the directly treatment, or if you look at the treatment at the hospital ground, must be politically desirable, and the wastewater technology industry would develop new processes and new products if the wish is so. So the most interesting technologies at Polytech are mostly for industrial or municipal wastewater treatments, but they can also be used for the specific needs of the hospital wastewater treatment. We found technology vendors coming from France, the US, Germany, Netherlands. I will show later on modular water solutions. I wouldn't present each bubble here. So here, Molière from the US are pioneers. If you look at the nanobubble technology, so it's provide in situ chemistry using air to achieve best-in-class wastewater treatment. If you look at the filtration side, you might know the company named Mann & Hummel, one of the leaders in filtration technologies. They have experience in municipal wastewater plants, also in the pharmaceutical industry and in hospitals, but the filtration systems are not yet suitable for small treatment plants at hospitals, so their adaptation is needed. Berghof is a company also from Germany, produces tubular membrane filtration systems, MBR, direct ultrafiltration, and the quality of these permeate allows to further process the wastewater into grey water, at least free of micropollutants, to be reused in the hospital. So this also might be a suitable way of treatment. As I mentioned, the colleagues from the Netherlands, from PharmaFilter Plant Engineering Company, they're using Berghof membranes for the treatment, and also coming from the Netherlands, the company NX Filtration have a unique concept, as they told us. It's a filtration in only one step with their direct nanofiltration membrane. So it's a hollow fiber here who is doing a great job. It removes organics from polluted water. Also, if you look at the micropollutants, antibiotics, viruses, and also the fluorine chemicals, which are now hardly discussed. So this technology was tested by Veolia for a municipal treatment plant. So, and the technology should be also suitable for the decentralized treatment plants as at hospitals, but no experience yet. Yeah, well, some French technology vendor, Nereus, membranes for the filtrations used in different industries, and Nereus is also coordinating the project SAFE. It's in cooperation with the municipal wastewater treatment plant of Toulouse, and also involves designing, evaluation, and demonstration of the performance of a combination of processes for the treatment of domestic water and sludge. So if they have finished the SAFE project, it's to be seen that the technology works well for the municipal plants. If the technology can also be used and miniaturized, it may be used for the in-hospital plants. And also a company working on this field, more on the engineering side and on the consulting side, are the Eco Water Solutions for a year from Germany. Planning and construction of smaller plants are their business, and they have combined a biotop system with UV, ozonation, and activated carbon, so that these technology meet the quality of the so-called fourth stage treatment. I will come to this question later on. And well, beside that, we found interesting technologies also during our work as Enterprise Europe Network, as I just mentioned at the beginning, Alpha Cleantech from Switzerland, and also Green Ocean, Germany, Switzerland, startup for the next generation technologies. Here, treatment of highly toxic industrial wastewater. So this is their business. They are into the development and construction business, and they also see that the special reactors designed and the high cavitation offer a unique process efficiency and allow compact plants. So TRL here are between 7 and 9, depending on the technology. Last slide here on this side is a technology I showed a photo just 2 minutes ago. So the micro bubbles is a revolutionizing microflotation, which the revolution comes from, and the key technology, if you use this modern wastewater treatment by bringing it in situ into the water directly, in the river, in the sea directly, combined with an in-house development control algorithm. So microbubbles is being funded by the National Sprint Agency, though this is the agency which is looking for the really big innovation steps, as you call in German, Sprunginnovation. So don't know how to translate it in English. It's not jump innovation, but the big innovation steps. And the technology is primarily in development for microplastics here, but can be easily used and adopted for other kinds of micropollutants, maybe also in hospital wastewater. And last, coming to the microbial fuel cells, looking at the Applied University of Switzerland, Professor Fischer told us that they have these large microbial fuel cells, as they call them, and they have a long-term reliability, and the MFCs generate power while purifying the wastewater. So they save electricity, avoid pollutants stripping into the air. And the micropollutants at the very stage now are degrading by 67%. So TRL actually is, as he said, TRL 5. So technology can be further developed for the hospital wastewater. So yeah, now we come into the question is what the problem situation, centralized versus decentralized treatment. So primarily the municipal, the centralized wastewater treatments are primarily designed for the removal of biodegradable substances. So wastewater treatment plants are not able to completely remove all the pharmaceutical substances, as we mentioned before. So in fact, it has been shown that the pharmaceutical substances most frequently found in water do not generally originate from hospitals, but they are largely discharged into wastewater from private households. So one solution approach is if you have an additional forced treatment stage. Such an additional purification stage can primarily be ozone treatment of the wastewater and or activated carbon filtration, but it's not yet mandatory at the European level. So this is a political question. We also might address here in our Procure for Health project in Work Package 5. This is the action plan. And some countries, such as Switzerland, as a good example, are starting to introduce the fourth stage. But this stage is, as I mentioned before, is a costly question. So we would say, hence, to solve the problem, it is a political rather than a scientific decision if you're looking at this question, decentralized treatment of hospital wastewater, which also entail high costs for hospitals and their owners. So these fourth treatment stage step on the grounds of a hospital should be built as small as possible for the reasons of visibility on the one hand side, also for psychological reasons, but should treat the entire hospital wastewater. And if you ask experts, stakeholders, and as we do today in the Open Market Consultation, we ask you, these experts, stakeholders, which are in favor of purifying particularly problematic substances as close to the source as possible, i.e. in the hospital. And when you look at the contaminants, not all substances are so risky that it would be better to remove them directly in the hospitals. Some are not. And the cytostatics, antibiotics, X-ray, contrast media, others would be desirable if you could treat them on the hospital ground. So the introduction of advanced treatment technologies in the hospital would only make sense if the aim is to eliminate hospital-specific antibiotic resistances. There is an example which we found on the market or in Europe, a practical example. Denmark has decided that wastewater in newly built regional hospitals should be treated in a decentralized way. The older or smaller hospitals that use less polluting drugs are connected normally, as we do it here also in Germany, to the municipal wastewater treatment plant. So this was a decision which was taken by the politics here in Denmark. As I just mentioned before, it's rather a political than a technological question. Some examples for the pre-treatment in or at hospitals we found in Herlev Hospital in Denmark, here in Germany in 2 hospitals, District Hospital in Waldbröl is in North Rhine-Westphalia, as well as the Marine Hospital here in Gelsenkirchen, and 4 hospitals, 1 medical center in Rotterdam, 1 in Delft, the hospital in Nijmegen and in Terneuzen are very good examples we found on the market. So to come to my last slide, the question of whether new technologies need to be developed for the decentralized purification could not be answered conclusively. It is certain that the technologies used here in the treatment plants could also be used or adapted for decentral plants in hospitals. They have to be miniaturized, also become cheaper. Cost effectiveness is a big question, despite the more technological or chemical question. So the new technologies for the specific treatment must be developed or further adopted. It can be possible that in future new products for specific hospital substances must be developed. And to close, the 2 experts, one from microbubbles and one from the Switzerland, Roland Hammann, said that there is a lack of rapid adaptation of existing treatment technologies, so to the wastewater qualities. And secondly, the energy consumption is of an existing system is often very high. So energy treatment or the energy question is a big one, which has to be solved. There is the need for research, and also Professor Fabian Fischer is interested in further development of his technology for the wastewater treatment. So there are two voices here who says that they are interested in the right research and development, and this also fits to our needs here in the Procure for Health system. As Ali mentioned, the preservatives, the sodium azide, is a problem that in hospital occurs. So they are not allowed to discharge sodium azide into wastewater. And normally what can be done, the only solution is that they collect all the wastewater in the separate tanks. So since these preservatives are used in for analytical reasons in the laboratories there. So one last vote. If we don't do this, the local environmental authorities can close the hospital. That's actually impossible. So that is an example from our Swedish partner from the region Västra Götaland. So yes, this was my presentation on what we found in the market analysis, and I thank you for your attention and hand over to my colleague Egil von Korvas. Thank you.
Thank you, Carsten, for the very informative presentation. My name is Egil. I am part of Corporate Procurement Services, and we're partners of the Procurement Project.
Egil, could you please hold the mic near your mouth, because we can't hear you well enough.
Oh, sorry. Can you hear me now?
That's better.
Okay. Sorry about that. As I said before, my name is Egil. I am part of Corporate Procurement Services, and we are partners of the Procure for Health project. And I'm going to present you the results of the state-of-the-art analysis. First of all, what is the state-of-the-art? The state-of-the-art analysis, which includes the prior analysis and the API sets, identify products, services, standards, patents, and publications to define the TRL of relevant solutions. Depending on the TRL of the solution, then we follow different procurement procedures. If the solution is from TRL 1 to 8, preferably TRL 4 to 6, a pre-commercial procurement PCP is used. If the TRL is 9, which means that the product is ready and on the market, then public procurement of innovation solution is used. And on the IPR sets find out which of the information available in the public domain, existing products, ongoing products, development, and published ideas is already protected by IPRs by searching for registered intellectual property held in the national or international database. And as for the methodology that we used in order to conduct our SWOT analysis, first we use, based on the keywords identified, we deliver the existing product and services based on the keywords from the use cases. We define the keywords, we used IP Analytics platform, which is an intelligent platform to search for the standards and patterns, and we analyze the research outcome to identify the relevant ones. And also we follow an interaction with our partners, which cases the need, we discuss the technologies and the outcome of market analysis details. Also, an initial output of the market analysis report from the need was used as a reference point. And throughout the search process, the list of keywords was further refined without extremely precise queries that could potentially overlook pertinent items. And finally, the search was limited to the years 2013 to 2023, the last 10 years, in order to guarantee that the material included was up to date and focused on modern research and technology. So for the pattern search, we use the following keywords identified in the use case. So we use the keywords used at hospital, pharmaceutical, wastewater treatment, pathogen removal, innovative technology, advanced disinfection systems, contaminant removals, and others. And using those keywords, our analysis revealed research in the following aspects. Revealed research in the aspect of treatment and management of medical wastewater, both on-site and off-site, particularly from hospital sewage, methods for separating pathogenic microorganisms in hospital sewage, a variety of innovative approaches to water treatment. We found inventions focused on comprehensive and efficient wastewater treatment in hospital setting, which incorporate various stages and technologies to address different types of pollutants. We found different wastewater treatment devices and methods, invention and system related to the processing and treatment of high toxic wastewater, hospital wastewater, and waste gas, a laboratory comprehensive wastewater centralization system treatment apparatus, and a comprehensive centralized wastewater processor for laboratory use, environmentally friendly and organic agents for removing pathogen in medical wastewater processing systems, among others. And we also found some tools and technologies used in those patents. For some examples of tools include filtration devices, collector wells, microfiltration device, contact oxidation tank, disinfectant tanks, etc. And as for technologies, some examples include microfiltration, ultrafiltration apparatus, ultraviolet radiator, filtration and precipitation techniques, and among others. As for the patents results in general, we identified more than 1,800 patents, which 18 were relevant to our challenge. These numbers resulted from a steady numbers of patent applications from 2013 onwards in different domains such as medical technology. The patents find application in several industry domains and fields such as pharmaceutical and waste and wastewater. And also we found that academic institutions are among the top patent applicants, along with businesses that are active in the domain, something that could indicate as this research focus domain, because there are a lot of academic institutions there. And also we found that the patent applicants in the field are quite dispersed. And on the right, you can see the top 10 applicants in the domains. You can see that we have a combination of academic institutes like Harvard and MIT and University of California, along with some businesses that are active in the domain. Here in this graph, you can see the industry trend for the past 10 years, from 2013 till 2023. You can see that there is a steady increase in the number of patents in several industry sectors, such as medical technology, technologies for adaptation to climate change, and environmental technology. And here you can see the geographical distribution of the patents. You can see that the top 5 applicants are United States, China, Japan, Republic of Korea, and Canada. And you can see that Europe is lagging behind in patent applications, patents, something that could indicate that there is a significant room for innovation in Europe. As for the standards, we only found 11 relevant standards in our research, and the majority of them relate to wastewater management in general, and comprising both off-site and on-site aspects, and no standards specifically related to hospital wastewater treatment. The lack of a lot of standards and relevant standards in the domain could again indicate that there is room for innovation in the domain. And here you can see a standard example. We have the title, for example, handling of waste material in healthcare facilities and veterinary healthcare facilities. You have the standard document ID, the publication date, and the abstract that help us to read and analyze the standard itself, if it is relevant to a challenge or not. And this was from a presentation. Just to sum up, we found some relevant patents that are cover some functionalities, but not all the functionalities of our challenge that we want. And especially we saw a lack of patents in the treatment of hazardous materials and materials that are not easily dissoluted and not easily treated from our current solution that we have. And that was it. Thank you very much.
Well, thank you very much, Egli, and Karsten, Carlos, for Ali, for your fantastic presentations. So I think now we will go through the questions that you post on the chat. Of course, if you have any other question, we can tackle it as well. So the first question we have is, let's start from the beginning. Are there opportunities for suppliers, operators who have already developed a system to address hospital wastewater or sewage? If so, is the engagement different from proposals that require development? Well, of course, when we talk about pre-commercial procurement, we talk, as my colleagues explained, about solutions that are at technology readiness level, let's say between 3 and 8. No, let's say that there's still room for development. But of course, as I was also discussing in the chat, this is complex, no, and it may happen that some technologies are already development, but other aspects are not yet. So that's also the idea of this event, to gather all the feedback we can from you and decide which is the best procurement approach that we can select. So if we decide that there is room for innovation and we decide to implement a PCP, which is in principle our idea, we are talking about solutions that need to be developed, not solutions that are already available. However, if we realize after this open market consultation and based on the market analysis that it was conducted, that there are already solutions in the market that can at least partially tackle the challenge, then we may decide to go for a public procurement of innovative solutions, of course, taking into account that we need a certain aspect, there are certain aspects that need to be integrated or modified in order to fully satisfy the need of the procurers. But it will depend mostly on the technologies that are available in the market and the level of maturity of these technologies. I don't know if any of the colleagues want to complement this or it's clear. Okay. Well, we have a second question that is concerning the phases of the PCP, concerning phase 3. What will be the scope of phase 3? It is expected to validate the solution at one or more hospitals. Will it be defined under the national? Well, this other. Okay, so concerning the scope of phase 3. So usually what we do in a PCP, of course, this will be decided in the future, when we are already working in the tenders specifications. But usually we build a prototype in phase 2, and that prototype is tested in usually one place. Usually they are the facilities of the lead procurer, and then in phase 3, usually the prototype is tested in more than one location. For example, if we have public buyers from different countries, we try the prototype in different hospitals in this case. And you also ask about the national law, which will be the applicable law. Well, the idea is to have several public buyers from different countries that are buying together. Of course, we need to choose one that will be the lead procurer, the one who will lead and contract on behalf not only of itself but also of the other public buyers. And it will be the national law will depend on who is the lead procurer. So, for example, if the lead procurer, imagine that this Servicio Andaluz de Salud, which is settled in Spain, then the applicable law will be the Spanish law. The same, if we decide that a hospital from France will be the lead procurer, the French law will be the applicable law. And there is a very interesting point here, which is also about the list of contaminants that will be under the scope of the PCP. Of course, we won't provide a general classification. In the case that we decide to conduct the procurement, the tender document will specify in detail all the technical requirements, all the components that need to be tackled, how they need to be tackled, etc. We don't want to say we want this solution because, of course, in PCP, we always want to give room for innovation. However, all the details that the solution should comply with will be set up in the tender document. So do not worry about this because, of course, we are working, as I say, in the preparatory phase. We have still work to do in order to define everything for the tender document. And I think that were all the questions so far, but please just feel free to write in the chat or even raise your hand and formulate your question or your comment. It's very welcome. Okay, under PCP, is a sharing of pilot costs between the technology provider and the owner of the hosting site possible? Yes, it's possible. It depends on what we decide to include in the tender document. So usually the supplier is responsible for transporting the prototype to the facility, place the prototype in the facility and remove it after the pilot. But this is flexible. we can decide in each case what is best for us, and also, of course, best for the supplier. So we always try to reach some kind of balance, no? But in principle, of course, the public buyers offer the facility to test, but everything concerning the transport, the installing the prototype, removing the prototype, etc., is paid by the supplier. Juan, please.
I don't remember if you have said, Beatrice, that the PCP is normally paid by 100% by the European Commission. This money is going to the hospitals or the buyers group, and they pay the developer. And this include nearby every cost they have. There will be a specific budget, let's say 500,000, and if the company needs 500,000, that's fine. If they need 600,000 to develop, then they have to co-finance it by 100,000, for example. No? But normally it's about 100% paid by the European Commission.
Yes, thank you, Juan. Of course, this is the case if we are having a grant from the European Commission, no? If which is the idea, no? If we as a consortium of public buyers, we apply for a project, no, EU-funded project, and we get the money, that will be the case that Juan perfectly explained. If we as public buyers or the public buyers decide to buy together, but without the grant, then the money will come out of their own pocket, of course, yeah. But we hope with the first scenario, which is the most favorable for everybody, and of course, it's also feasible at this extent. There is also another question about when the tender documents are going to be ready and if it will be before the questionnaire. Well, the answer is no, because the questionnaire is part of the open market consultation. So what we want through this questionnaire is gather as much information as possible. And then based on this information is when we will draft the tender documents. When we have a clear idea of what the market can offer, what are the shortcomings or gaps of the market, etc., then we will work in specifying the details, specifying the components that need to be eliminated from the water, and this will be included in the tender document. But that's a next step. So first, we still have to decide which is the most suitable approach from a procurement perspective, and then is when we start with the procurement itself. About the PCP tender, is expected to be launched for phase 1, and then another tender for phase 2, and another tender for phase 3. Correct. But with some details, let's say, because we have an open competition, so everybody can apply and submit a tender for the PCP. We select the best, in our opinion, not the best bids, and we award several contracts, as I mentioned before, to several providers. Then at the end of phase 1, when you already conducted the work for this phase, so design a solution, we will evaluate the solutions, and those solutions that has been considered as satisfactory and also successful will be invited to bid for the next phase. So in the next phase, there is another bid, but let's say it's a mini competition because it's a close competition between the suppliers that are already part of phase 1. So it's not an open competition again. And the idea is that in this second bid, let's say you update your proposal based on the results you obtain in phase 1. And then the same for phase 2 and phase 3. So once you have built the prototype, then of course you will be paid. In any case, you are selected or not for the next phase, you will be paid for the work you performed. That's for sure. And then if your solution, your prototype is successful, you will be invited also to present a proposal for phase 3. So that is the dynamic of the PCP. And the good thing is that it's very flexible, and because we don't really know in advance which solutions we are going to get, it also gives you some flexibility, no, based on the experience of the first phase to present an update proposal for phase 2. And then we have also how aligned is this procurement project with the current negotiations on the urban WWT directive. I don't know, Luis, if you want to clarify a little bit your question. If you're still here. Okay, so yeah, to be honest, it's not an answer I can give you right now. I don't know if any of my colleagues can do so. Otherwise, do not worry, because we will publish the Q&A documents, and yeah, we will discuss it internally and provide an answer to this. Karsten, would you like to add something?
Yeah, as you just mentioned, I saw the question as well, and I think we have first to check the Urban Wastewater Technology Directive, Wastewater Treatment Directive, and if there is a possibility to align it here. But as you said, now after the Q&A session, we look at all the questions and provide the answers later on in our document. Yeah.
Yeah, but in any case, just to mention that, of course, we have to comply with the procurement rules, which here we have a flexibility with this procurement because it's only research and development. But of course, we need to comply with all regulations concerning hospital wastewater, sustainability, social aspects, etc. That's for granted. So this is something we will need to check, and in due time also include it as part of the tender document. There will be a need to generate base load data sets, which is specific to a given hospital. At what stage can this information be developed? Yeah, so that's a very good question. And again, that's something for us to decide to be included in the tender documents, also based on the feedback we gather from the market. But which specific hospital would depend, first of all, who are the buyers. So and once we have the buyers, it will also depend on in which sites we decide to make the pilots. Because of course, it may happen that the different locations have different also, let's say, status or different technical requirements, etc. So we have to look for a way internally to align these technical aspects in order to ensure that everything goes smoothly. So to answer the question, it will depend mostly on who are the buyers and which kind of installations and technologies the buyers have already implemented in their hospitals. Another question refers to the emailing of Procure for Health. Does Procure for Health offer an automatic emailing of PCP tenders to listed interesting technology providers? Well, that is something that I have to check internally with the communication team, but it will make sense, and I think it's like that. If you subscribe to the newsletter in the website, then they will send you emails not only with, let's say, the different aspect that we are conducting, the different activities of the preparatory phase, but also in due time you will be informed of the next step, of the launching of the tender, if there is any other updates in this preparatory phase, etc. So I will also check with the team, but I believe so.
It's a good proposition, Mr. Hernandez. And looking to Carlos and telling you all the participants today, we have our project technical meeting tomorrow. So this is a good suggestion, and we can discuss this tomorrow. Carlos,
let me add something on that. Our community platform is open and available for suppliers to register and to be aware of everything that's going on regarding all these activities that we're conducting. So as I said, we are mainly in our focus, or we are the demand of the innovations, but anyhow, suppliers, innovation ecosystem can register in our platform, and every information related to all these activities is available there. So I would suggest for you to go and register, and you will be for sure updated on any progress on these activities.
Perfect. And we have another question about the regulation to be considered in terms of hazardous waste, water directive, and other EU directives. There are a number of substances that they are already classified as hazardous, like the cytostatics, and it is not allowed to discharge them to the sewage system. Should this type of toxic be handled as a priority over other contaminants? Yeah, I think so. There are a number of substances that are good. Yeah. So yeah, indeed, this kind of substance should be probably included. That's something for the technical people also to work in. I am not so familiar with the technicalities, of course. And then we are aware that depending on the country, we have different components that can or cannot be present in the water. And this is something also that we need to work with in order to see up to which extent we include the components. No, which components, because also we know that some components can already be tackled, can already be eliminated, but there are another components that is not so clear, and there are already pilots on site and others that definitely nowadays cannot be eliminated. So that's also a work that we have to do internally with the technical partners to decide in which substance we will include in the future procurement. I think if there are no other questions, then perhaps yeah, let's give a couple more minutes in case something comes to your mind. Otherwise, Carlos, perhaps we can close the session.
Hey, thank you very much, Beatriz. First, just a couple of thoughts regarding this open market consultation. Quite happy with the awareness of that this activity has raised, and the level of inputs, the quality of the inputs that we're receiving, that tell us that we are for sure, and when I say this is a topic that has relevant consensus among health systems in Europe, that statement has been validated today. We have also seen that there is still a lot of room, as we said, to adapt our tender process to the real needs and the real inputs that we have. As Beatriz said before, procurement of innovation is the paradigm of co-creation. This is a journey to be covered together by supply and demand side. We, as you have seen, we have done that at a very, and I have to thank all Procure for Health team, a very, very intense work and I think of high quality work, but we, the innovation ecosystem has a lot more knowledge, and you have already been giving relevant feedback. So my last remark would be, yeah, be aware of what's going on. First suggestion, as I just said, is registering our platform, because our objective is always to be as open, as transparent as possible, because we need you in order to be able to develop these solutions. And well, I think that's it from my side. Hopefully you can also work a little bit on the questionnaires. As I said, it is our main objective to be able to produce reasonable and feasible and interesting tender process for you to apply to. So please give us as much feedback as you can. It's very useful for us. I think that's it from my side. If there is no further remarks, thank you everyone for joining us, and stay tuned for further updates.